Hi, good afternoon from Austin, Texas at the Combined Ophthalmic Symposium. We're pleased to be here today with Dr. Nicole Fram. Good afternoon. Thanks for being with us.
Thank you so much for having me.
You know, I think this is a great opportunity, Nicole, for us to discuss endothelial keratoplasty because it's a surgery that's near and dear to your heart, as we know, and it's a surgery that has evolved and changed over the course of time. Over the past 5-10 years, we've seen such evolution here. I'm wondering if you can share with us some of your experiences, in particular about how technologies have helped your outcomes in this kind of procedure.
Right, so we can think back to DSEK. I started doing that actually as a resident in 2007, and we had to cut our own tissue. iBanking has always been a partner in this with us, and so they came up with pre-cut DSEK tissue, and it helped us tremendously in having reproducible results. All of a sudden, our rebubble rates were going down, our primary graft failure was going down. It took the anxiety away. Cut to a few years later, we start looking into DMEK. And we went through the same issue in the beginning. We had to prepare our own tissue. We had anxiety during that portion of the surgery. iBanking then responded again to our needs, and now we're able to get pre-stripped, pre-stained, pre-stamped, and pre-trephinated tissue and be able to cut back all that anxiety, which affords for better patient care.
Yeah, that's a really good point. And so can you describe a little bit for us what kind of configuration or how is the tissue received by you when you receive it in the operating room suite? What does the tissue look like? How is it arranged? And how does that help you to provide a more smooth surgery?
Right, so the tissue that I primarily use is from CorneaGen, but there's many at Lions has wonderful pre-cut, pre-stained, pre-stamped tissue. And this tissue comes in a little vial. And it has Optisol in it, and it also has different ingredients that are anti-infective, such as amphotericin B. And basically, it comes in a little sled, and the tissue is pre-stamped, pre-stained, pre-trephinated, and it's inside the goiter tube. And the tube is then held in place with this little slide. You take the slide out. I do everything under BSS because, God forbid, the glass tube breaks. I always have a backup tube available. I take it out. I put it on a 5 cc or a 3 cc syringe. I put it through a 2.4 millimeter incision after I prepared the eye, and the surgery went from being a half-hour procedure or 45-minute procedure to just a routine cataract in some cases, and I mainly just waiting for the air bubble to kind of create the surface tension for it to stick, and that's the longest part of the procedure.
Well, that's really great. So it sounds like it not only shortens the OR time, but it also increases your confidence and reduces anxieties about the potential outcomes of the procedure, right?
Yeah, and I think that when we were getting this pre-stained and pre-trephinated tissue, maybe even 3 years ago, it wasn't at the quality that it is now. So I think iBanking in general, and particularly CorneaGen in this case, which I use, it's really improved my outcomes.
Yeah, I want to go back to something you mentioned earlier, Nicole, about storage media. And you mentioned anti-infectives such as amphotericin B. Tell us about why that's important in terms of preserving corneal tissue.
Well, so Optisol has been around for over 30 years, and there hasn't really been innovation in this area. And we do know that having fungal issues after keratoplasty can be devastating, and although they're extremely rare, if we can do something to innovate the way we have storage media, we thought it would be beneficial. So CorneaGen responded to that. Our European colleagues have been putting amphotericin B at a certain concentration in their Optisol media for years. And so University of Washington did a lot of research to look at what concentrations were safe. And so we looked at safety data. And so they just recently increased the amount of amphotericin B that's going to be in the Optisol storage media with CorneaGen. And I think there's been studies from other eye banks that are actually going to follow suit, which is, that's what we want to do. We want to drive innovation so that we can have, better patient outcomes and better safety.
Great. Well, that's a really important point, and I'm glad that you brought it up. Nicole, this has been a great discussion for us this afternoon about evolution in endothelial keratoplasty and how new preparation for tissue has really helped to increase your efficiency and confidence in the OR. Thanks so much for being with us.
Great. Thank you so much.